Well, that particular news item leads us to our conversation shortly, and we want to speak to the Cabinet Administrative Secretary, that is Dr. Mwangangi, who will be joining us virtually. And good afternoon, Dr. If you can hear me, I'd like to just speak your first insights around, are we ready for the vaccine as Kenya?
Yes, thank you. Thank you, Abby, for having us here today. And we're really eager to share with the country where we are when it comes to rollout of the COVID-19 vaccine. And to answer your question, yes, the country is on the right path. The country is making great progress in being able to ready itself to roll out the COVID-19 plan. And, we've organized ourselves both at national government and county government to be able to deploy the vaccines once we get them in a manner that will be efficient and in a manner that will, of course, target what we consider to be priority groups. And so as it stands today, when we look at, what it takes to roll out the vaccine, it's important to always perhaps look at it in terms of 5 lenses. In terms of the resources, do we have the resources available to be able to roll out this vaccine? Yes, we do. And I'll be sharing with you more information on that. When it comes to the logistics and the heavy infrastructure that is required to roll out these vaccines, do we have those ready? Yes, we do have those ready. When it comes to our healthcare workers, do we have plans to ensure that they're well trained and ready to deploy the vaccine? Yes, and I'll be sharing that with you today. Okay. And then, of course, when it comes to the community, again, are Kenyans ready to receive the vaccine? And we have initiatives underway to ensure that Kenyans will be willing and able to receive the vaccine once it's ready.
Right. Quite interesting sentiments you've raised there, Dr. Mwangangi. And of course, the big question is, do we have the money in the first place to bring in the vaccine? How much are we likely to spend on this?
Great. So Kenya has been able to join what we've been calling the COVAX facility. And the COVAX facility is essentially a circle where countries have come together and have been able to negotiate down the cost of these vaccines. And so as it stands today, should any vaccine that has undergone WHO pre-qualification and manage to get into the COVAX platform, Kenyans will be able to get that vaccine at a cost of 700 Kenya shillings, that's $7. And so through this mechanism, Kenya, together with a large number of countries, probably over 69 countries, we've been able to negotiate with pharmaceutical countries to be able to bring down the cost of that vaccine. And that, of course, will be bared by government. And so the Kenyan will be expected to come over and receive the vaccine at no cost to them. In total, on aggregate, the budget that we are, looking at and trying to compute in terms of needs and logistics and the target population is coming close to 34 billion Kenya shillings. However, this is a budget that will be staggered over the next 3 financial years. And so as it stands today, yes, we are ready. We do have the initial budget that is required for the initial rollout for this financial year. And so it's all systems go when it comes to the resources.
And speaking about all systems go, Dr. it would also be important to know how many doses of the vaccine are we likely to get as a country. At the same time, in regards to Kenyans paying the 700 shillings, when you look at the realities on the ground, just getting a mask, which I'm holding, has been a challenge for Kenyans to even afford. Will they be able to afford 700 for the vaccine? Is there still room?
Absolutely. Let me clarify that, and just to be very clear, the cost of a vaccine dose is 700 shillings, but no Kenyan will be expected to pay for this. Government will pay all costs.
Okay.
And so you as a Kenyan, you as a 50-year-old individual, you as a frontline healthcare worker, you will be able to receive this vaccine at free at cost. We are the ones as government who will absorb that 700 shillings.
All right. Thank you for that clarification.
Thank you. Yes. Thank you.
Thank you for that clarification.
So thank you. No worries, Abby. So then you had a question concerning the vaccine candidates and how how we intend to roll this out.
All right.
In terms of our population, we're hoping to ensure that at least 40% of the Kenyan population is vaccinated between now and June 2023. So that's about close to 18.8 million Kenyans. There are about 20 million Kenyans. And what we've done is that we're going to stagger this number in the next 3 years. And we're going to start with what we're terming as priority group 1. These are Kenyans who will be vaccinated in the first phase. And these are Kenyans who we consider to be working in critical areas. So it includes, of course, our healthcare workers, but also non-healthcare workers who are working within hospitals. Our cleaners, our porters, and all the other support staff who work within hospitals shall also be vaccinated. Our teachers, as well as immigration staff, as well as police, as well as the military, are all considered critical workers who we shall then, of course, prioritize in the first phase. And so our first phase target, as we talk within this financial year, is 1.25 million Kenyans. And they consist of those groups that I've discussed and described to you: the healthcare worker, the policeman, the immigration man, the person who's working in a teaching institution or supporting or administrative staff in these institutions. And that's phase 1. Phase 2 would continue post this financial year all the way to December. And it's important to appreciate that these phases will continue to overlap. And in phase 2, we'll be focusing on those who are over 50 years of age. Because remember, COVID is a disease that really affects those who are over 50 years of age, and they are at high risk. And then, of course, phase 2 will also focus on those who are over 18 years of age, but have chronic conditions. Perhaps those people who may be struggling with diabetes, hypertension, renal disease, HIV, TB, blood disorders. These are people who we shall prioritize in the second phase and ensure that we get them on board in terms of this vaccination. And then, of course, also those who work in specialty areas, particularly tourism industry, shall also be prioritized in our second phase. And then the third phase, depending on continuous availability of this vaccine, will be expanding beyond this into people who live in aggregate communities, the prisoners, different refugee camps, and areas where, we're able to then meet our total target of 40% of Kenyans vaccinated by June 2023.
It's quite an ambitious plan there, Waziri. And of course, the bigger question right now is, in regards to the logistics, how will this be handled? Do you have the capacity? Do you have enough trucks to supply the vaccines across the country? Do you have plans to talk with the counties?
Thank you. That's a very good question, Abby. We recognize that really it is a mammoth task. We've been watching different countries in terms of the progress that they're making, and indeed, this is not going to be an easy task. In terms of logistics and infrastructure, we have a plan set out. We've thought about the current infrastructure we have in the country, and one of the key principles that we will be deploying is that we are going to use the existing infrastructure as much as possible in order to be able to really leverage on those efficiencies that exist. And Kenya, for a very long time has been a country that has been undertaking vaccinations. We've been able to deploy a wide range of vaccinations and even introduced new vaccines. I'm sure you're aware of the HPV vaccine for girls over 10 years of age, and many other vaccines that have been newly introduced in Kenya's vaccine schedule. And so Kenya has experience when it comes to introducing new vaccines, and we will be leveraging on that experience. In terms of infrastructure, I think the first point, every time you're discussing an immunization program and discussing its requisite infrastructure, the first thing is, where are people going to be vaccinated? Where can a Kenyan walk in and find the vaccine ready and available for them? And what we're planning to do is, particularly in our first phase, we've been able to ready about 400 facilities across the country. And these include both public facilities and private facilities. We'll be looking at our level 4 hospitals. These are the county referral hospitals, our level 5 hospitals, as well as our referral hospitals and other, same level tier private facilities. And that will be the first point where you can get your vaccination administered. In terms of knowing, as a Kenyan, how do I get there? Will there be a list or a schedule with my name? We're going to be utilizing different logistic information systems. We have one known as Chanjo, and Chanjo will be able to really administer for us the rollout of this vaccine. As a Kenyan, you'll be registered on Chanjo. You'll be given a date when you should present yourself to the facility. When you get to the facility, the healthcare worker will be waiting for you, and they'll be able to administer your vaccine. One of the important things to remember, and really, we're requesting each and every person in the country to be well aware, particularly those who will get the vaccines, is that you require 2 doses for this vaccine to be able to be effective. And so because you require 2 doses, upon presentation at the facility for your first dose, we'll be able to take your records, your information, and to be able to schedule you to come back for the second dose. And so phase 1 really is a focus on these 400 facilities. When we look at our cold chain infrastructure, which is a very important part, because these vaccines can only remain stable under certain temperatures and therefore can only remain effective if held under those temperatures. We've been able to do assessments of our current capacities in the country, and we're happy to say Kenya has close to 10 huge regional stores, that help us to store these vaccines once they come into the country. And these stores have the requisite infrastructure when it comes to the cold rooms and the freezers and the refrigeration. And we've been able to, determine that in Kenya, we can actually comfortably deploy a vaccine that requires to stay between 2 to 8 degrees centigrade in terms of positive temperatures. In terms of negative temperatures, we can get to negative 20 degrees centigrade. And when we look at the current vaccines that are available, particularly those that have already been pre-qualified by WHO, then already we can see that the AstraZeneca vaccine would be one of the ones that we'd be relying on because of the cold chain temperatures that it requires, as well as the Moderna vaccine, which can be able to be stable at negative 20. So as it stands right now, in terms of infrastructure, we are ready to go. Should we want to deploy Pfizer, should we be able to pick that as a candidate, we will require to invest a little bit more when it comes to, negative 70 degrees cold chain storage facilities. And that is a discussion that is underway to be able to determine perhaps this vaccine requires to be deployed in urban areas where that capacity may be available, as opposed to perhaps rural areas where the capacity that is there is that of 2 to 8 degrees centigrade. And then the most important thing, of course, is then logistics, moving the vaccines from the depots to the counties, to the sub-counties, eventually to the health facilities. And again, we'll be using the current infrastructure that we utilize, partnering with KEMSA, partnering with private sector to ensure that that logistic chain is, foolhardy from point of delivery all the way to the healthcare facility. And then, of course, perhaps what I would consider as a doctor most important would be the safety and the monitoring the effects of this vaccine. We have a very agile, robust monitoring and evaluation framework. Kenya has always adopted mechanisms to be able to assess vaccines and to look for any adverse effects that may come out. And so we will be rolling out such a structure, starting all the way from national government to the health facility. This will require a lot of engagement by county health officers, particularly the technical teams who conduct surveillance at the county level, as well as our faith-based organizations and CSOs who have long supported us when it comes to immunization. And so part of the questions that we will be asking will be, did you get a vaccine? Did you get a fever thereafter? Did you have any side effects? Have you been able to return to work? And all this data will be collected and, analyzed on a day-to-day, almost on real-time basis, so that we can ensure that every Kenyan is getting the vaccine in a manner that is safe and that we don't have any adverse effects. So there's a lot going, in the background, a lot of machines and clogs all working to ensure that the country delivers the vaccine in a manner that will be safe and effective for all.
All right. Dr. Mercy, the other big question that many Kenyans would like to hear your stand on, how is it that we settled on AstraZeneca and not Moderna or the other variants that are in the market? What was the binding consensus that made our country settle for AstraZeneca, which has already been having some difficulties in South Africa, just next door?
Yes, so one of the key considerations while rolling out any vaccine always begins from the regulatory phase of a vaccine. before you accept a vaccine in your country, before Kenya accepts a vaccine in terms of rolling it out to the population, we have to make sure that, one, the vaccine is safe. And so Kenya has been able to engage WHO, who is one of our pre-qualified institutions that looks at the vaccines and their safety, amongst many other organizations around the world who ensure that vaccines are safe. And these vaccines have then been able to get into those platforms and are qualified for those platforms. Again, Kenya has been lucky through its engagement with the University of Oxford and Kemri Wellcome Trust in Kilifi has participated in clinical trials for AstraZeneca with good results here in Kenya. This is a trial that has taken place in Kilifi. Around 400 people were enrolled in this trial. And all those people have been able to successfully, undergo through the trial with any ill effects recorded. And so by virtue, one, of having WHO pre-qualify this, having our own home trial here, we were able to determine that, AstraZeneca is one of the candidates that we can utilize. As it stands right now, it's important that we are clear that, yes, we are saying AstraZeneca is the first one, but it does not mean that we are discounting any other vaccine candidates. As we talk, and it's a situation that keeps changing every day, more and more vaccines are being pre-qualified. I'm sure you've seen in media, in different spaces, we have Sinovac, we have many other vaccines that are coming on. Johnson & Johnson have a vaccine as well, that's undergoing different pre-qualification phases. And so Kenya is saying that the vaccine candidate that we prefer as a country requires to be a vaccine candidate, one, of course, that has been proven to be safe and useful and effective.
All right, Dr. I understand we need to go on a quick break. Just hold your thoughts, When we come back, I'd also want to hear your views around the economic implications. Now that the vaccine is coming into the country, will we see the curfew being lifted? Will we see the nightlife changing? Well, we'll be getting back to Dr. Mwangangi shortly.